Here's what we know about the novel coronavirus of 2019, or COVID-19 as it's being called. There are more than 80,000 confirmed cases of COVID-19 worldwide, and of course this constantly changes, so that is as the last number that I got before I got out of the car. Around 3,000 people have died as a result of the virus. The virus poses the most significant threat to people with weakened immune systems, like seniors or pregnant women who may be at higher risk of developing pneumonia or other complications. Many Americans throughout New Jersey and the nation are justifiably concerned. But it's important to remember that the vast majority of the coronavirus cases are considerably mild, akin to a bad cold. That's encouraging in one respect, but it also makes preventing the virus's spread more challenging. There could be people with the virus who feel perfectly fine, and they may not know that they're contagious. Already the CDC has confirmed one case in a patient in California who, at this point in time, there is no information that they ever came into contact with someone who recently traveled or they themselves had traveled. If there's anything we know, it's that now is not the time to panic, but rather to prepare. It's critical everyone exercise common sense. I'm sure the doctor will mention some of this, but the things that we should do in the normal hygiene, from the average flu: wash your hands, cover your mouth with your sleeve. When you cough, if you feel sick, don't go into work. I'd encourage employers of all sizes to be mindful. Don't pressure sick workers to come in. Embrace flexible options like telecommuting. Think about your role in keeping our workforce healthy and our economy strong. Likewise, everyone should be on the lookout for scams. It's amazing that, but for every great challenge, there are those who are trying to cash in, and I've heard some of these already, targeting people's fears about the coronavirus. So to consumers, beware of anyone trying to sell you a vaccine that just doesn't exist. Seniors, watch out for calls from fraudsters pretending to be your grandchildren stuck in a foreign country and in need of money fast. I've heard that one too. And everyone, watch out, in this case, I hate to use these terms, but for fake news. Facebook is not a credible source for health information. You have to stick to trustworthy sources like the Centers for Disease Control, which is cdc.gov/coronavirus, cdc.gov/coronavirus, N.J. gov/health. There is a New Jersey coronavirus health line, 800-222-1222. Those are some of these. And my own, we have established on menendez.senate.gov/coronavirus information from the CDC, the New Jersey Department of Health, and other credible entities that we will continuously update for New Jerseyans to have. So there's plenty of good, solid scientific information to get if people have questions. Now, no one person can prevent a public health epidemic. That's why we need coordinated government response strategies to protect our public health and keep the American people safe. I've been impressed with Governor Murphy's proactive leadership to make sure that New Jersey is prepared for a potential epidemic. Unfortunately, that kind of leadership is something I am concerned that we do not have from the very top of our country. I say this not in a partisan way, but I am concerned about where we're at, where our response is, what the actions the administration takes. So I choose this to be, I hope, constructive criticism. On February 24th, the administration sent a supplemental funding request to Congress that was laughable in its lack of detail and disturbingly inadequate. They asked for about $2.5 billion to combat COVID-19, half of which came from gutting other healthcare programs like Ebola, at a time that we should be shoring up our defenses. They didn't tell Congress how the dollars would be spent or whether state health departments would be reimbursed for their efforts on the front lines. And so that's just simply unacceptable. This is a challenge with the administration. We have an administration that has stripped millions of Americans of their health care coverage through its policies, leaving them less able to see a doctor. An administration that in 2018 fired the government's entire pandemic response chain of command, the entire pandemic response chain of command, and disbanded the Global Health Security Unit within the National Security Council. It's just a year and a half ago. An administration that has sidelined experts throughout our government agencies. An administration that in fiscal year 18 sent us a budget cutting $1.2 billion from the Center for Disease Control. In 2019 fiscal year sent us a budget cutting $1.3 billion in the Center for Disease Control. In fiscal year 2020, they sent us a $1.2 billion cut to the Centers for Disease Control, and once again, in the latest budget presented to us, cuts $1.2 billion from the CDC. Thankfully, Congress has rejected those cuts to date and has restored the money. But the question is, we need leadership from the top at the end of the day to face the challenges that we have. Just yesterday, we learned from a whistleblower that the administration may have sent government workers to quarantine sites without adequate protection and training, and then allowed those workers to mingle into the general population and even take commercial flights. And when this government worker raised their concerns, what happened? They reassigned her. Suppressing the truth is not the American way. That's what happened in China. And the first doctor, Dr. Li Wenliang, who sounded the alarm about COVID-19, ended up succumbing to the infection and dying. This is one of the reasons I'm concerned about the president's decision to put Vice President Pence in charge of this response. We asked for a czar. We asked for a medical czar, someone like these gentlemen who have deep expertise in this field. But Vice President Pence, with all due respect, just doesn't fit that bill. When he was governor, he played politics with people's lives in the midst of Indiana's worst HIV outbreak. He's told people that smoking can't kill you. And he's not someone who we find has a deep belief in science. And if anything we need right now, it is a commitment to science and to those who have the foundation of science to tell us as to how we move ahead. I'm alarmed by reports that all government statements on the virus now must be cleared by the White House first. I'd like the Center for Disease Control to talk to us directly at the end of the day. We should be hearing directly from these leaders at the CDC and the National Institutes of Health. America has the best and brightest public health experts in the world, and the last thing we need to do is to muzzle them. Now, I'm using every tool at my disposal to strengthen our federal response to the coronavirus challenge. In Washington, I hosted 3 briefings with all of the top interagency department heads, the Secretary of Health and Human Services, the head of the Center for Disease Control, the head of the Acting Secretary of Homeland Security, representatives of the Department of State, and others who, in their combination, have all different elements of dealing with the challenge of this virus. For my colleagues in the Senate and for all of us to have a good foundation on what is the challenge that we're facing. I thought so Newark Liberty International has the resources for screening at at-risk travelers. It's great we have an international airport. It's a tremendous economic driver, but in moments like this, it has a potential risk. And so we fought very hard to get the necessary resources to make sure that those who may be at-risk travelers can be screened effectively at the airport. And earlier this month, I wrote the Office of Budget and Management urging the administration to fully reimburse states for their efforts. We need a robust, fully funded strategy to protect our public health. That's why I support Senator Schumer's proposed $8.5 billion supplemental funding request. This funding includes $1.5 billion to bolster the CDC's work on the front lines and to work with institutions like CDI to be able to do that, including their capacity to work with local partners like the experts right here at Hackensack Meridian Health. We can't allow the disease to move faster than the data. And I am concerned that we are in a moment in which we may be allowing the disease to move faster than the data. We should not allow that to happen. It also includes $1 billion for the National Institutes of Health coronavirus vaccine research. It ensures the federal government will be able to reimburse states like New Jersey that are already devoting significant resources like personnel, lab equipment, and medical supplies to the threat. And if the virus spreads, we cannot afford to have resources running thin. That's why Congressman Pascrell and I both wrote to the Food and Drug Administration on the steps that they are taking, to understand the steps they are taking to preserve the medical and drug supply chain. As the virus spreads, China's manufacturing disruptions are leading to potential supply shortages. And how we are prepared to deal with that is critically important. Finally, any emergency funding we approve must prevent the President from siphoning this money away for other purposes. We have voted for the Department of Defense to defend the nation. He's taken billions of those dollars to build his wall. At the end of the day, I don't want to see a penny of coronavirus be used for anything other than dealing with the disease. Likewise, if a vaccine breakthrough is achieved, we have to make sure that every American in need is able to access it and afford it. Otherwise, it is a false promise. The United States is capable of answering any challenge so long as we have the necessary resources, a strategy to succeed, a respect for science, and a commitment to the truth. I'll continue to use every tool at my disposal to protect the health of New Jersey families and all Americans. Together we can prevent the coronavirus challenge from turning into a full-blown crisis.